Due to the aging population and rise in maternal mortality rates, many European countries, including Germany, have a massive shortage of nurses. One such country where the demand for nursing jobs increases every year is Germany. The scope of nursing jobs in Germany for Indian nurses is expanding every year. The German government has been working towards resolving this issue by organizing awareness programs and creating awareness among prospective candidates about available opportunities. Why is Germany such a great place for nursing jobs? Germany is a great place to work as a nurse because of the public health care system. The social health care system covers the entire population. Nurses in Germany are in demand, and the country has a good tradition of nursing. Nurses in Germany also enjoy high social standing. Germany is one of the wealthiest countries in Europe with an excellent healthcare system, so there are many opportunities for nurses to work in various positions. The salary is good, and the professional prospects are promising. One factor that stands out is that nurses can specialize more than they could elsewhere because there are not enough nurses to fill all positions in Germany. The scope of nursing jobs in Germany is expanding as the living standard, and nurses' salaries in Germany are attractive. Germany has a shortage of nurses, which means that nurses have more opportunities to progress in their careers faster. The wages are good, the culture is welcoming, and the working conditions are the best in the world. Germany has a shortage of nurses, which means that nurses have more opportunities to progress in their careers much faster than in other countries. This is because there are many vacant posts but not enough people to fill them. The wages in Germany for nurses are much higher than in other countries, and this attracts workers from other European countries like Spain and Greece who often leave nursing jobs back home because they can't afford the high cost of living. Nursing tasks. Nurses will assist the doctors and assist people in various ways. The nurses' responsibilities include care of patients, independent observation, guidance, and support and care for patients, inpatients and outpatients. In addition, based on the specific area of expertise and the qualifications, nurses could also carry out medical directives and assist with medical procedures. As a nurse staff, they are also an experienced source of information for patients' families. The main tasks of nurses in Germany are given below: patient care, pediatric nursing, elderly care. Entry requirements for Indian nurses in Germany. Anyone who wants to be employed long-term in nursing in Germany must complete the entry requirement before being accepted as a nurse in Germany. Listed below are criteria for nursing jobs in Germany. Recognized qualifications. First of all, Indian or non-EU nursing qualifications should be recognized by the government of Germany. The German authorities will check whether your nursing qualification is comparable with German nursing qualification before initiating other processes. German language proficiency. The nursing profession requires communication with doctors and patients. So nurses should be able to communicate with the patients and doctors. All non-EU nurses, including Indian nurses, should have obtained a B1 certificate in German language. B2 level proficiency is desirable. Good health. All nurses should produce a medical fitness certificate to be considered for nursing jobs in Germany. Personal trustworthiness. To prove their trustworthiness, nurses should produce a police clearance certificate or use the German document of good behavior, Verantwortungszeugnis. Eligibility criteria to work as a registered nurse in Germany. GNM diploma, or BSc/MSc degree nursing. B1/B2 language proficiency in the German language. Minimum 6 months experience. German language requirement for nurses. As nurses have to communicate with the doctors, medical professionals, and patients frequently, German language proficiency is essential for nurses working in Germany to Indian nurses. If you're planning a nursing career in Germany, starting your German lessons as early as possible is recommended. A B1 level proficiency in the German language from Goethe/Tauch/OSD is obligatory for registered nursing positions in Germany for Indian nursing staff. Document required. The following is a list of documents required to register as a nurse in Germany. All documents and certificates must be translated into German before submitting them. The police clearance certificate and the doctor's fitness certificate are valid for 6 months. Therefore, it is better to obtain the PCC only after passing the German language test. 10th certificate. 12th certificate. GNM/BSc/MSc mark lists. Transcript of nursing qualification. Biodata. German language certificate.